My name is Sky Nicole Shipley, and I am in the Sports Medicine 3 program at South Tahoe High School. For my rehab project, I decided to do a femoral shaft fracture because I thought it was an interesting thing because it's the largest bone in the body. The mechanism of injury for a femoral shaft fracture is a high-impact collision, excessive stress on the femur while leg is bent, or a direct blow to the thigh. This can be caused from car accidents, a fall from a great height, gunshots, or high-impact collision during sports. These types of fractures are also very common in child abuse cases. Just like any other bone, there are different types of fractures, although the most common is an oblique displaced fracture. These are two different x-rays that show a more obvious fracture where you can clearly see the displaced bone. This is another x-ray of a femoral shaft fracture, but it is less obvious because it is less severe. Almost all femoral fractures are treated with surgery, with the exception of very young children who can be treated with a body cast. After surgery, the leg is usually put in a cast or step brace for the next 8 weeks. Physical therapy for this injury can range from 3 to 6 months, and there will usually be post-surgical x-rays at 2 weeks, 6 weeks, and 3 months to make sure everything is healing right. Types of surgery. An internal fixation is usually only used as a temporary fix when there is more severe injuries present and the patient doesn't have the ability to undergo a longer surgery. For an external fixation, metal pins are placed into the bone above and below the fracture and are attached to a metal rod outside the skin to act as a temporary stabilizer. For intramedullary nailing, this is the most common surgical method and includes a nail being placed through the bone across the fracture that is held in place with screws. The third method is most commonly used when intramedullary nailing is not an option, which usually is present when the fracture goes up into the hip or down into the knee. This is when the bones are realigned and held in place by screws and plates on the outside of the bone. Here is an example of the intramedullary nailing where you can see the nail and the bone being held in place by screws. Here you can see the plate that runs along the side of the bones being attached by screws for a plates and screws fix. This is a picture of what the external fixation looks like both inside and outside of the leg. For the surgical timeline, you start with pain management by using medication and ice packs. You also do range of motion by doing basic passive and active exercises to prevent stiffness in the knee. You also do isometric muscle contractions focusing on strengthening, exercises for the quadricep muscle. Proprioception training is also important to improve balance and coordination. For weeks 4 through 8, you increase weight bearing based on the doctor's instructions. You do more active range of motion, progression to more advanced quadricep strengthening exercises with resistance bands or weights. You practice walking with proper gait mechanics and addressing any imbalances. Lastly, after week 8, you start focusing on functional exercises, so basically doing things that you would do every day like stairs, and then sport specific for athletes getting back to training. Some complications that can come with this surgery can be infection, especially since it's a larger injury, so there is a higher risk. Blood clots, which can develop in the leg and travel up to the lungs. Nerve damage. Delayed union or non-union, which means the bone heals slow or not at all. The hardware in the leg can also irritate the surrounding muscles. A fat embolism, which means bone marrow can enter to the bloodstream and travel to the lungs. And like any surgery, there is risk for complication with going under anesthesia. Next, there is a therapy case study done in 2006 showing that almost 50% of people who had a femoral shaft fracture surgery had some kind of disability 12 months post-surgery. After this study was published, there was another study done with a 28-year-old male who was in a high-impact car accident which caused him to fracture his femur requiring surgery. Rather than going for a gradual rehabilitation approach, the doctor did immediate weight bearing and focused on strengthening the patient's specific impairments. The outcome of this was the patient's impairments all went away within 6 months, and he was able to go back to his job that had lots of manual labor after only 6 months. Another study that has been done on treatment is shockwave therapy in long bones. As of right now, the most common way to help treat non-unions in the long bone is an autologous bone graft. The problem with them is they only work 80% of the time, and it's invasive due to the fact that you will need at least 2 surgeries. An alternative method to help delay a definite non-union in long bones is shockwave therapy. Shockwave therapy is a non-invasive treatment that uses high-energy sound waves to promote healing in specific areas. The bone graft is more typically used because shockwave therapy is used to target smaller bones and is still not proven to be the best method for long bones. Shockwave therapy is becoming more common and can help with post-surgical rehab.